heard about oh, there we go. Had you already heard about the resources prior to signing up to this webinar? And hopefully Jen's going to pop that one up on the screen. So if you'd like to answer yes or no, that would be really, really helpful. Oh, we've got lots of people taking it. Thank you. Great. Okay. So lots of people saying no, which is great. This proves that the webinar's useful. Great. Thank you. And thanks for engaging in that one. Oh, we've got a few more people taking it. Fab. So if you want to end that one, Jen, we can move on. There we go. Okay. So Crossing the Line was funded by the NIHR. And it was an 18-month study. We were given funding at the Association for Dementia Studies. And for those of you that aren't familiar with us, we're based at the University of Worcester, and we conduct research around dementia studies and education. We had some great co-applicants to the study, so Midlands Partnership NHS Foundation Trust, Dementia UK, and the fantastic Susan Briggs, who was our PPI representative and co-applicant, who was hoping to come today, but I don't think she has managed to, but apologies if you're there, Susan. So we had some also great partners, Alzheimer's Society, Dementia Carers Count, we worked with Doogie Mac Hospice, Dementia UK, Home Instead, NHS Midlands Partnership Trust, and Tide. So I guess going right back to the beginning, what the aim of the study actually was. So it was to gain a deep understanding of the experiences of family carers relating to their provision of personal care to people living with dementia. And the study was aimed to help us hear the often hidden voices of family carers on this important topic. We wanted to analyse survey and interview results and use them to identify what could be put into place to better help carers. And we were thinking that this could be advice and guidance materials that family carers could use directly, maybe resources for health and care professionals and staff, or a combination. Personal care can mean different things to different people, and it does cover quite a wide range of activities that a person with dementia may need help with. And those activities may be described as intimate care. So when we're talking about personal care, we're thinking about helping someone with washing and bathing, going to the toilet, but also helping someone to take care of their personal appearances, getting dressed, undressed, looking after their hair and skin and nails, and help with eating and drinking. So I'm just going to show you this video that Professor Dawn Brooker, who was working on the study in the co-production side of it, filmed for us, just talking a little bit about what the project was.
So we called this project Crossing the Line because it's all about when people cross that line from becoming a family member to becoming a real supported carer of somebody living with dementia. And, you know, none of us plan to be a carer, but we do know that the vast majority of personal care is undertaken by family members. And even if you've got a professional background, you know, taking your mum to the loo or cleaning your husband up after he's had an accident is not the sort of thing that any of us are prepared for. So it's a really important area, and we know from talking to families that it's an issue that creates a lot of emotional distress, a lot of exhaustion, and a lot of real challenges to the dynamic of the relationship. Surprisingly, there's very little research done in this area. So what we wanted to do was to really try and understand what it was like for family carers who had crossed that line into becoming a very supported carer, to learn from them, and then to develop materials that would help other carers in the future who were faced with those challenges. The research project itself was in three main stages. Firstly, we did about 300 surveys, which went UK-wide to family carers who'd got experience of living with dementia. We then used the findings from that survey to help us design interviews so that we could look in much more depth at people's experience. And we had about 30 of those that were done over a time period in the middle of the study. Then what we did was to bring all the information from the surveys and the interviews together with what we called an expert working group to really interrogate the findings, and also to help us design materials that would be helpful for carers in the future. We had 3 big co-production workshops here at the university that lasted a whole day each. The people attending were some fabulous family carers who were supporting people living with dementia, people with dementia themselves, a lot of people who've got professional experience of working with people living with dementia. And interestingly, a lot of those professionals had also got in-depth family experience themselves. And also charities and organisations that routinely provide help and advice for people and families. At the end of the project, we've got some great information and top tips and pointers that we can use to help families in the future.
Okay, so I'm now going to pass you on to my colleague Jen, who is also a researcher at the Association for Dementia Studies, and she's going to go over some of those key survey findings that Dawn was just talking about in the film that's come out of the research.
Yeah, as Faye said, my name's Jen. I was involved in this Crossing the Line study, and just one of the initial findings that we had from the survey was 82% of people saying that they had faced challenges when they were providing personal care to a family member or a loved one with dementia. And I think for us, that reinforced that actually this was a really important area for us to be working on and looking at, and finding a way to hopefully improve the situation for people who were providing personal care. I think, Faith, I'm going to have to do a next slide, please, if that's all right. So in terms of who actually was completing the survey, as Dawn said, I think we had around 300 responses, and 50% of the carers that responded to our survey were the adult children of the person that they were providing personal care for. And we also had quite a big proportion being the person's spouse. And the vast majority of people that were completing the survey were identifying as female. So I think, you know, we can sort of see who was represented in the survey. And just to say, the illustrations that you're seeing on the screen throughout this presentation are from Rachel Brazel, who was a former illustration student here at the university. So it's great to be able to make some links within the university to help with our resources. So when we were thinking about the areas of unmet need in terms of the support that that people were receiving, it was quite interesting to see that only 34% of people had received help from social care support staff, and that, I think for us, that was a bit surprising that it was quite that low. And on the other side of things, if you have the next slide, we actually had quite, I personally was expecting this to be higher, but a third of people said that they didn't know where or how to access help and where to look for that information, and the really practical support that they were after when it came to looking for personal care. So hopefully by providing and making these resources available, we can reduce that number even further. And in terms of the amount of care being provided and how often it was being provided, we had 55% of people who were actually living alongside and with the person they were providing care for. And although 44% were living separately, we still found that the vast majority of them were actually providing personal care on a daily basis. So even though they're not living physically in the same house as the person they're providing care for, there's still that ongoing regular provision of personal care. And 69% of people responding to our survey said that they've been providing personal care for more than 3 years, and in a lot of cases that was on their own with no support from anyone else. And I think for us, that highlighted the scale of and the relentlessness in some aspects of what carers are facing, family carers are facing, because it's that constant and long-term need to provide personal care. It's not just a one-off, or you do it for a couple of months and that's it. It is that long-term commitment that people are making. And yeah, hopefully the resources that we made out of it can make that situation a little bit easier for some of those people. And I think now it's Thomas that's going to be talking about some of the overarching themes that came out of our findings.
Yes, thank you very much, Jen. Can everyone hear me okay? All right, excellent. Yes, I'm going to talk about, well, obviously Jen has just talked about the survey that we did. We also did interviews essentially from mainly from people who were involved in the survey, but also from other people who, we basically recruited to the project. And they were really looking at people's, a more in-depth look at people's experiences of providing personal care or helping someone with personal care. And we really kind of, I mean, these are very general, what you can see on the screen there are very general kind of overview themes. We have much more kind of nuanced themes under each one of those headings. So just to explain them a little bit, what we found really was that, for the first theme, we lumped into just general observations about being a carer. I mean, that doesn't tell you an awful lot, but that included things like, for example, what people think of as personal care is not necessarily what professionals might think of as personal care. Obviously we have this idea of the term personal care even isn't really used by carers necessarily. And it can involve an awful lot of things, a whole range of different things from, helping someone to wash, to clean teeth, to even actually eating as well. We didn't initially include that with personal care, but that is something that obviously, why would people think there's a distinction between these kind of things you're helping someone with? We found that personal care, however you define that, can be demanding in different ways. It's not just physically and emotionally demanding. It can be demanding on finances, on time, on your responsibilities, and so on. And it could also involve, actually helping someone to go out when you're going out and about doing things. It's not just in the home. And I think that's something that we didn't consider originally. We found that preparedness and prior knowledge of somebody could really, or helping someone with personal care could really make a big difference. So whether someone had any kind of background in personal care or not. But then we also found that even people who were from a professional background found it was very, very different when they were actually caring for someone who was close to them. And that's something that we should consider. So, yeah. And the previous quality of the relationship with somebody could be a big factor. And that could go either way. So if someone was very close to someone, it could ease things a little bit, or it could make it a little more awkward or a little more uncomfortable for somebody. And likewise, we had reports of people feeling closer to the person that they cared for once they took on that caring role. I think I'm just going on to the second one. I'll go on to getting help from health and social care services. That was something that we found, wasn't always easy for us to hear as people who were in the sector, whether in academia or as practitioners, because of course people do have some rather mixed experiences of getting help from health and social care. And one thing that was overwhelmingly people said was that they felt that the onus was on them as a carer to seek out that help rather than it coming to them in a timely fashion or when they needed it, or being able to find things, basically find help and find services. And we found that there were a lot of reports of things not being consistent or reliable enough. And also poor integration of different parts of the health and social care, integrated system, whether that's health services, different types of health services, local authority, or from third sector. There's not great communication between those things, as we know. But so we also found that there's services really need to be explained what was out there exactly. It's not always clear what things are just by being told there is this or there is that. You don't always know exactly what that thing is, who it's available to, what exactly is on offer. And then there was kind of mixed response to using things like technological aids and gadgets and so on. They could be absolutely brilliant and really helpful, but they have to be appropriate to the person. Talking about strategies that carers might use in assisting with personal care, we found a lot of this has to be personalised, but a lot of this focused around taking time. Really, I think was one of the things that we found was a big theme with people, that when people first took on a caring role, they would often steam in and say, right, okay, I'm going to do this, I'm going to, and so on. But then essentially they would realize that you'd hit a wall with that kind of attitude of just like, I'm just going to go in and take care of business. And actually you'd think, well, you really need to sit back, take time. Things aren't going to be easy. They're not going to go as you might expect, and really communicating with the person you're caring for as to as to what actually is going to work and what's going to be acceptable and so on. And there was a lot of talk around that kind of slowing down, communicating and taking time. And respecting people's lifelong routines as well, I think, is that, if people have done things in a certain way, like people who've always taken baths throughout their life, then they're going to be, if they're suddenly required to take a shower, that's going to be uncomfortable for them, and that's going to be an extra challenge that you don't necessarily need. So finally, on issues for carers in looking after their emotional and physical health and well-being, this is something that obviously it was talked about an awful lot. And one thing that we found is that people did have multifaceted feelings, really, of overwhelming feelings of guilt, particularly in many different ways. People would feel guilty, not just because they may feel that they just didn't have enough resource to actually support somebody, but they might also feel angry and frustrated about the position that they find themselves in. And they would then feel guilty about feeling angry and frustrated about that. So there was an awful lot of kind of feelings, very complex feelings, and very hard to deal with. But we should say that people did also talk about some positive feelings of feeling pride and satisfaction at being able to support someone and help somebody out in that position. So yes, we know that stigma and shame around talking around personal care is still an issue. We found that a lot of people had never spoken about this side of things, even with health professionals, which is quite interesting that, this is such a huge area of care, and yet people still often don't talk about it or don't have the opportunity to. So and family units really can make all the difference as well. We know that families are complex and can be challenging, and of course, but where we found where families did all pull together and have particular roles and support each other, that made things so much more easy. And of course, carers need breaks and effective strategies to look after their own mental and physical health, and they don't necessarily need to be formalized breaks. They just need to be things that are appropriate for people, ways in which people cope, and that they can find that help them. So that's that. So next slide, please. So that was from, basically we did a good 30 odd review, about 30 interviews. And those are broad general themes. We also looked at 4 interviews in a much more in-depth targeted way, and these basically are themes that came out of them. So this is much more really kind of like personal kind of perspective of people, and they kind of reflect what I've just said, really. So the things we found are that people felt either united or alone, depending on the role of friends and family, as I said. There was the idea of she's here, she's safe is really around the idea of that someone when someone is being cared for by someone who knows them well in their own home, then you're much more likely to get person-centered care there. There was a worry that if people are transferred to an institutional setting, they may not get the best care. There was also, the conflicting emotions that I've mentioned there. Again, overwhelming feelings of responsibility, of people feeling trapped and abandoned. Navigating the unknown, of having to adjust to change. And again, having plan and preparation, a systematic approach, and taking the time to think about that, again, I think is a big theme. But also access to support, as I've said, it seemed like an endless struggle to people, and it keeps on changing. Obviously throughout the journey, things will keep on changing, and you have to keep seeking new types of support in different ways. But one thing that was particularly difficult to hear was that there were some examples there of people their relationship with professionals and professional support had simply broken down, and they would say things like, well, it's difficult and they just don't care, meaning health and social care services they felt that they didn't seem to care about the person, and they were just, you know, looking after what they could afford or whatever. It's yeah, money was always seen to be an issue. And then finally, there was the issue of identity, of people feeling that they had to kind of reconcile who they were now with who they were in the past, and that it would have an impact on how people felt about who they were, because obviously their lifestyle had changed, could change quite dramatically, and their relationship to the person they're caring for could change as well. So that's that. Okay, so thank you very much.
Thank you, Thomas and Jen. That was really insightful. I think it's always good to, I'm going to go on to talk about the resources now, and I just wanted to let you know where all this information has actually come from. So yeah, from the back of this research, we wanted to create resources that were going to be really useful and helpful and accessible for people, using this wealth of knowledge that we'd built up, and the kind of connections that we'd made with family carers from within the study and professionals. And there's this quote here that somebody in one of our workshops said, you know, we need something that enables you to learn simply and effectively and empowers you as a carer. And I think that's really important. So yeah, we thought about how we can create these co-produced resources. We held co-production workshops with professionals and family carers and lots of people with those kind of dual approaches, to talk about what is actually useful, because we're very good at, you know, conducting research and then putting things into practice that maybe aren't useful, maybe in a report format or something, and people aren't able to actually access that information. And it was discussed and by people that it's always very important to have things that are accessible digitally, but also physically in paper version. So we wanted to create a real variation of things that came out of the study. So the first thing that we worked on, we were 15 co-produced booklets covering a wide range of topics around supporting someone living with dementia with their personal care. And we worked in our co-production groups and with family carers and professionals who contributed to lots of them, pieces of the writing, to put together these informative booklets that had hopefully the right tone to them, and content, variation in content, that were hopefully quite manageable to pick up and read. And they were evaluated by people from across the UK, including our equality, diversity and inclusion advisors, who sifted through them line by line. So the booklets cover kind of 15 key topics around things like, why does having dementia make personal care difficult? Legal and financial issues, dealing with complex emotions, those kind of physical issues that impact personal care, changes to the home environment that may make giving personal care easier, strategies that will help make giving personal care easier in the long term, staying strong, help with continence and using the toilet, help with washing, showering and bathing, teeth and dentures, dressing and undressing, eating and drinking, personal appearance, caring for hands and feet, and then support with good hearing and vision. So we kind of separated them into these kind of more general things, and then these specific personal care activities. And these are things that have come out, these are things that came out of our data of being things that people may have particularly struggled with or required more information around, or that were potential challenges. So another thing that we worked on were a series of films, and we were really, really lucky to have lots of family carers who were really willing to share their stories around their experiences of supporting someone with their personal care, and agreed to share them on film, various different ways. And I'm going to show some of these to you. So the first one I'm going to show is Di speaking about her experience of supporting her mum who's living with dementia. And yeah, very, very grateful for Di. She was a brilliant part of the study, who contributed so much of her lived experience. So yeah, I'm just going to share that with you now.
Incontinence products can be helpful if the person will wear them. It took Mum 11 years to agree to wearing an incontinence pad. And even today, she will take her pads out. So flushable wet wipes and towels are useful, particularly if you've got somebody who can't keep their legs crossed because you end up with more soiled clothing. Elasticated waistbands and Velcro are a godsend when you've got to get somebody's clothes and shoes off really quickly. And always have a change of clothes ready, because when somebody's standing there half naked in the cold, upset, frustrated, the last thing you want is to say, well, hang on a minute, I've got to go and find a change of clothes. You want to get them, on the toilet, clean and changed, and get back to what you were doing. You don't want them hanging about getting upset. And if you can think about the bathroom layout, try and plan for the future, because invariably there are going to be two people in there. You could be there with mobility aids. You could be there with all the other stuff that you need, and the clothes and the pads. So do think about how you can use that space. And I was at a conference last month, and there were several people with young onset dementia talking about their experience. And one chap said, I have just rearranged my bathroom and put in a bidet. And that was his strategy for how he was going to try and keep himself clean without having his wife getting involved too early. And I thought, well, that's great. That's a really good idea, something I wouldn't have thought about. And he was managing his strategy by thinking about his layout.
So one thing that we found that came out of the research was that family carers really found that peer support really helpful, and listening to other people's stories and being able to relate to other people's experiences, which is why we wanted to try and document some of these things to add to the resources. So I'm now going to
incontinence product.
I'm now going to play a film that was made by a man called Paul about his experience of supporting his wife. And Paul very, very kindly came and spoke at one of our workshops, but he also invited us into his home to film. So I'm just going to play you some of his experiences and top tips now.
Incontinence products
right.
Can
going to the sink to brush teeth, it's a bit like she must be looking down a cavern or down a dark hole, because she grips the sink. And what she sees, I don't know, but to actually manage the process of toothbrushing is actually quite difficult. V-shaped toothbrushes. With this toothbrush, when I apply it over the teeth, it's just nice and gentle, backwards and forwards, and it takes the top surface off the teeth. This one particularly we use at night. This one is morning, and there are 3 sides to this. So when you apply that to the tooth and just apply a bit of pressure, it encompasses all 3 sides of the tooth. And gentle rocking backwards and forwards, and maybe slightly to the right or slightly to the left, covers all of the tooth and the top without having to do a significant movement in the mouth. Perfumed waste bags, because regrettably with the incontinence, we do seem to be getting through quite a few of these at the moment. So a good supply of those. We're getting through probably a roll of these a week. With Miniderm S, every time I change her pants or pads, and then she's been cleaned up, there are times when, if it's been necessary, I'll put her in the shower. But before I finish off the task, I will always apply that as a barrier cream.
And did it work well? one? Because there's
Well, she
lots
has
of different types.
Yeah, because she has no skin blemishes.
Yeah.
I'm assuming it's working okay.
Well, yeah.
If she goes in the night, there's a chance of scorching or skin damage.
Yeah.
So far, nothing. So I
Yeah.
think that does work. Actually.
Yeah.
You know, she had a problem with constipation
Yeah.
recently. She was administered one of those after 30 days.
Wow.
So 30 days
30
of constipation, and they got to a point where nothing was happening. So despite the fact that we were using glycerins, it wasn't really getting anywhere. So they administered this instead, and boy, did that work. These are the pants, which work really well. They're a good size, and when they're used, 350 millilitres is the sort of capacity of that. And these are the pads. So the pad, again, high capacity, very good, but I think only limited to about 200, 220 millilitres. After that, they start to spread. And these work with the net pants. So these would be the net pants which come with the pads.
To wear over.
You put these on, and slot that in under here.
Okay.
But then what I tend to do with these is I put a pair of knickers over the top just to keep it all secure.
Yeah.
With these, they work completely independently.
Yeah.
So you don't need anything to go with those. And this is one of our best friends at the moment. Fred and Flow biodegradable wipes.
Yeah.
So the wipes. And we do get through quite a lot of those. So that's the wipes.
Yeah.
The other thing I do with the wipes is they're not wet enough sometimes to deal with the product. So I soak them. If I take 3, soak them, and then I can deal with the volume before then popping her in the shower.
Yeah, okay.
So yeah, obviously, you know, different strategies work for different people. People face different challenges, but we think it's great to hear these very, very personal stories and tips from people. So we wanted to make sure that all of this information, including the films and the booklets, could all be accessed in one place, because we know that there's lots of information out there, but sometimes it's difficult to find everything, and it can be on lots of different types of websites or different places. So we have hosted it all on our website, which you can see there, and if you've got your phones out, you can scan, and that hopefully that QR code will take you to the website. And you can download the booklets from there via PDFs. They're obviously free. All of the films are in there. There's lots of other films, and there's a section on there where there's an A to Z list of topics, so you can sift through which topic you might need support with.
Incontinence.
So here's another poll, if you're all willing to take it. So have you used the resources? So some of you have accessed them. Maybe you may have used them either personally or professionally. It would just be interesting to know whether they're getting out there and who's using them. And feel free to put anything about them in the chat if you'd like to. We do have some paper copies available, so you can email me, and I can put my email in the chat at the end. You can email me, and I would be more than happy to post you some copies out. Okay, so lots of you haven't used them yet. Some of you have. Great, thank you. So Jen, do you want to stop sharing that one? I can go like that. Okay. Okay, so we have distributed nearly 4,000 paper copies of them so far, and we've had over 9,400 downloads from our website, and we think that's pretty good going. we have disseminated them through our partners who have shared them on various websites and through blog posts and newsletters. Some of our libraries locally at the moment have been requesting them. We've had various Amaral nurses want to use them, dementia cafes and meeting centres. We did an interview on the local radio about them, which we felt would be a great way to reach people who wouldn't necessarily maybe be using, I don't know, social media to find things. We've had one of them translated into Welsh, with plans to translate the rest of them into Welsh. And we've had lots of requests from unpaid family carers to directly share them with them. So our next steps, we've done quite a lot of work to disseminate the resources, but as we know, there's over 700,000 family carers supporting people living with dementia. So we've still got a long way to go. And we started to measure kind of the impact around it in the way that we can. But obviously, research is funded and we do need to move on to think about next steps. So we've been thinking about who we've managed to reach so far and who have we not, and we've got more work to do around that. Thoughts around how we can reach a much wider audience of family carers for people living with dementia. What we'd like to know what the best practice is at the moment for disseminating and reaching wider audiences, and thinking about the translation of the resources. So are there different languages that they could be translated into as well as Welsh? Formats, could we be translating them into more formats? We've obviously got booklets, we've got our website, we've got films. Is there more work to be done in formats? Funding, we need to get some more funding. Yeah, we've started to look at this impact, and we've had some great kind of feedback from people. So someone from Talk Dementia Carer Support Group was talking about one of the booklets and has said, we think that it's probably one of the, if not the best publication that we have come across so far that will really assist family carers when caring for their loved one. So thinking about next steps, just another poll, and our last one, based on, I guess, what we've been doing and what I've shown you, do you think that a follow-on project with a focus on reaching a much wider audience would be beneficial? There's limitations, obviously, in an 18-month study, but we've had so much great feedback and we know that they're being of benefit to people. It would just be great to know what your thoughts are, and, you know, do you think that would be, you know, do you think it's a good direction to go in? Oh, good. We've got lots of people saying yes. We've got an unsure, which is fine. A few unsures. That's great. Thank you. Fab. Thank you. So I'm just going to click off that. Move on. So yeah, we have put out an impact survey about the resources, which if you would be happy to take based on what you've seen, if you're happy to do based on what you've seen today, that would be really useful. You can scan that QR code, or hopefully Jen's going to put the link in the chat. And another lovely bit of feedback from someone who said reading through the Crossing the Line booklets has been really helpful for me in thinking about how to approach personal care with my mum. I found the booklet on eating and drinking particularly useful. The booklets are so friendly, the tone is spot on. I also think the booklets addressing emotions are really well written and validate how I feel as a family carer. So yes, please let us know what you think of them. You may not have been through the website yet or had a look at them. So please do and let us know by completing that survey. We'd really appreciate it. And that knowing that impact really does kind of mean a lot to us as researchers to be able to move things forward. So yes, that's me done with talking. So if there's any questions, please let me know. I'm going to stop sharing. I'll leave that there for a minute if anyone wants to make a note of contact details. As I said, if you'd like any of the booklets posted out to you, please do drop me an email. Obviously, we have got some. We can't send out hundreds to each person, but we can send a smallish quantity. So yes, I'm just going to stop sharing. Great. So if anyone's got any questions that they want to ask, or any things that they want to raise, then we'd be most willing to have a conversation. But if not, you can go ahead and get on with your lunch. Can't see them. Oh. There we go. Thank you, Amanda. Okay, great. So we've got some links to look at. That's really useful. Thank you. Kelly said great resources. Would you like us to seek permission before using them professionally? No, that's fine. Jen said no. That's great. And yeah, thanks for engaging with the chat as well. Really pleased that some of you will be looking at the website. Yeah, please do feel free and drop me an email if you've got any questions, or yeah, you would like any copies.
Yeah, and I mean, I said no to needing permission to share them. They were using them professionally, but if you are in a position to just sort of quickly drop us an email to say that you are using them, even if it's not sort of via the feedback survey, just letting us know that they are getting out there and where in the country they are, because you know we're very Worcestershire focused a lot of the time, but this is something that we think really has scope to go UK wide. So yeah, it'd be great to hear where it's being used and how it's being used. So please do get in touch.
I'm just about to share with a sort of a friend and acquaintance in Wales, Jen. Now that we've got the Welsh translation of that one booklet. So yeah.
Yeah,
that's great. Thanks.
It's booklet 8 around continents, I think, is the one that's available in Welsh now, and that's also available via the website. So the page about continents, you can also read that in Welsh and access the booklet in Welsh. And yeah, as Faye said, we will hopefully be expanding the range that's available over time as and when funding permits.
Fab.
And there's my email again in the chat if you'd like to email me. Yeah, that's great. But yeah, thank you so much for joining us, everyone. I'm going to end the call now. But yeah, have a great rest of the day. Bye.